All right. Good afternoon. Eric Sergienko, your County Health Officer, and we're just wanted to do a quick COVID-19 update. Joining me today is Joe Lynch. He's our Director for Administration. That's his day job here at Health and Human Services, but he has been instrumental in implementing or bringing to fruition our new guidance that we received from the California Department of Public Health last Friday. I think that's probably the key reason for doing this update, and he'll go into some of the sector guidance in detail. But what I'll do is kind of just provide an overview of where we're at with COVID-19 in the county, in the region, talk a little bit about those expanded guidance, but let Joe get into detail on those, and then we should have plenty of time for questions and answers. I will say though, is that we've been looking at these guidance for about 5 days now since we received them. And so we may not have all the answers. We may be taking notes and doing the deep dive back into the paperwork, because essentially we've assimilated over 150 pages worth of guidance in the last 6 days. So a lot we're learning. So the current situation right now, again, there are no active cases of COVID-19 in the county. There's no one currently in isolation or quarantine. However, there's lots of activity in the counties around us. Some of you who are dialing in from north of us in Tuolumne or have been paying attention to the news may have seen a press release that just came out. They have a case involving a healthcare worker who works in a skilled nursing facility. And so they've just begun the outbreak investigation on that. But as you know, if you've been following the outbreak, you know that once a case gets into a skilled nursing home, a skilled nursing facility, that can lead to some very poor outcomes. So we're thinking about them, hoping they get that under containment rapidly. In Madeira, they have been dealing with a large cluster associated with the family gathering. I think that speaks volumes about the need to stay in as smaller groups as possible, because there's more than a dozen people associated with that, including hospitalizations, and thankfully no deaths. And then of larger concern to the north and south of us, Stanislaus are seeing their biggest rates of transmission ever, and they're truly in community transmission. They're no longer able to do investigations of all of their clusters. And the same is true as in Fresno, where we're seeing a real acceleration of cases there. So we're seeing that growth of cases. And we're also seeing the same thing in Southern California. To the west of us in the Bay Area, they really are continuing to see a decrease in activity. They are holding firm on their stay-at-home orders, and they're seeing the results of that. So that said, as I mentioned, about 12 guidance came out a week ago Friday, and that the bottom line from that is that we're able to open things like campgrounds, RV parks, lodging into short-term rentals, bars, wineries, and then some changing guidance on restaurants. And the intent behind that guidance was to allow counties at their own discretion to open those activities and allow some economic activity, but to do that in a safe manner. And so as I'm looking at that, we have the tools in place to ensure that we can continue surveillance for disease, identify it early, do the contact tracing, quarantine those contacts, and if needed, implement surge protocols. That said, that surge, I think if were to happen, we would be looking at scaling back, but we'll talk about that later should that come to fruition. But I will say we're doing a lot for surveillance. I encourage everyone here that's listening to go ahead and get tested, even if you don't have symptoms. The testing facility is up there on Silva, and you can find the link for testing on our Facebook page. In terms of other things we're doing for surveillance, we're continuing our febrile respiratory illness screening at places of employment. And we're also testing wastewater effluent from Mariposa, from Wawona, and from El Portal. And to date, we're sending those off on a weekly basis. And through the month of May, we've been negative. So what that tells me is that with the combination of negative tests from the OptumServe site and from other clinics in the county, and from the testing of our wastewater, is that currently we either have no or a very, very low level of activity in Mariposa County. And we will continue to do that level of surveillance throughout the summer as we broaden the economy and receive visitors from outside the area. So that's the other thing that's going on today, is Yosemite National Park opened up at 5 o'clock this morning to anyone who had a day use pass that was obtained through reservation.gov, or have an overnight reservation in a lodging or a campground in the park. And we were just talking to the park staff. Things so far are going smoothly. No one's crowding. They're maintaining social distancing. It's really actually going as well as they had planned. So kudos for them for implementing what could have been a very difficult, very challenging plan. What was seen as a lot of crowding at other national parks like Yellowstone or Great Smoky. They haven't seen those traffic jams. They haven't seen those people crowding. So their plan is working as they hoped it would. So a little bit more about the expanded guidance, and Joe will get more into that a bit, but I did put out a health officer's order in regards to that, and that was for a 24-hour hold between a person moving out and housekeeping going in, and we felt that was a prudent measure to reduce the risk of transmission of disease. This is truly the riskiest thing we've done, is even though we've got increased transmission of disease around us, we're opening up our economy. And so any measures we can take to mitigate the impacts, we will do those. The other thing that I'm considering right now is a health officer's order for facial coverings, not for the general public, but within all of those 100+ pages of California Department of Public Health guidance, there are places where it says a person must wear a facial covering. As an example, within the restaurant guidance, it says that restaurant workers who cannot avoid getting within 6 feet of customers must wear a facial covering. So the intent behind writing that health officer's order is not to generate any new requirements, but rather put into one place all of the requirements that are in the different CDPH guidances. And then I've been telling people that we're kind of in stage 2.98. Joe's been saying we're in stage 3.1, but we're clearly combining some activities that are from stage 2, some from stage 3, maybe even a couple things from stage 4. But there are still some things that are not allowed in the current whatever state we're in. And specifically, it's nails and spas, nail salons and spas, large gatherings, specifically gatherings greater than 10, including things like music venues, but it does accept things like assemblage for free speech and assembly for religion. So those are sort of the things that we're maneuvering through right now. And I think Joe is going to highlight some of those things from the sector guidance that we've heard questions about.
Yeah, so good afternoon, Joe Lynch here. Over the last month and a half, we've had 28 sector guidelines come out from the state. In Mariposa, we've done Zoom meetings with restaurant owners, retail owners, business offices, houses of worship. And over the last couple of weeks, actually last week, we've done hotel, VRBO, bed and breakfast, kind of lumped together, bars and wineries, and campsites. I think the biggest question that's come out has been around the hotels, VRBOs, and bed and breakfast. So as Dr. Eric mentioned, with the health officer order for 24 hours before housekeeping can go in and clean a room, seemed like the biggest barrier for most of our owners. What we've continued to press as we've gone through all of the sector guidance is our ability to move forward as a collective unit community, all of us trying to do the right things, the better we'll be able to manage the risk. As Dr. Eric mentioned, lodging and hotels and bed and breakfast are the highest risk activity that we do. So what we've done as a county is offered our services to any business, hotel, restaurant, retail, for us to come in and actually help finish out a written plan, work on occupancy levels, find a hand sanitizer for your supplies, anything it takes to make our community safer from a mitigation standpoint. So as we go forward, on our county website, we keep our most current sector guidelines there, as well as the state has covid19.ca.gov /roadmaps to get all of the most up-to-date information. So the biggest questions that we received, and I see some questions coming up, so I promise to be slow so we can get to the questions, is, there's a question of what if people don't comply, or why can this activity happen and not that activity? What I would tell you is, as a general perspective, what we work on day in and day out is trying to do as many of the right behaviors as possible, as often as possible, so we mitigate the risk that we have, and it's still risky. I think Dr. Eric and I were talking earlier this morning, and this is the first time that we've said not only can people from California come to Mariposa, but people from the nation can come to Mariposa and possibly internationally come to Mariposa. So when we're working with hotel, lodging, or VRBOs, and we're talking about a 24-hour guideline, or we're talking about washing all of your sinks, or all of your laundry, or all of your linens, it's not to press down on the business, but it's to make sure that we're safer longer, so that we don't have a slide back. We've seen other counties, as I mentioned on my Zoom meetings, other counties have had to stop things like dining in and go back to curbside because they had some clusters and contact tracing. And that's what we're seeking to avoid here. So we're willing to work with any business to help you problem solve what it would take for you to meet as many of the state guidelines as possible, and help you out in any way. I think with that, we can start taking questions. I see quite a bit of them up there, and many of them would be answered with what I'm talking about, but I prefer to answer questions.
Okay, so our first question. So just curious, I watched the live on Tuesday regarding Airbnbs, and they mentioned everything has to be washed, whether it was used or not. I'm guessing that means every utensil, pot, pan, plate, glass, cup, throw pillows, and blankets, etc. What about curtains? What about toilet paper, shower curtains, and paper towels left on the roll after the guests leave?
Well, from a state guidance perspective, what I would tell you is I would attempt to do as much single item things as possible. So like a roll of paper towels, I may not do that, but maybe napkins, and then at the end of the guest leaving, take those napkins out. Again, going back to that safety message is, when you think about someone occupying a hotel room and having, if they are sick, having a spread in that hotel room, as many of the things as you can clean as possible will make it as safe for the next person that goes to that room. So from a state guidelines, yes, all dishes, all linens must be washed. I did not specifically see curtains, but if you have a curtain that's very porous, it's maybe something that you consider changing curtains to something more non-porous, so that you can wipe it down rather than having to launder it.
That's, again, the state guidance is pretty much anything that you can clean, you do clean. And it gets back to what Joe is saying, is as best as practicable, reduce the number of multi-use items in your Airbnb, in your VRBO. So you're reducing the number of dishes. Maybe what you're doing is determining the number of guests that will be staying there, and reduce the number of flatware or plates or whatever to that number, so that you have a reasonable expectation that stuff's being used, rather than having to wash stuff that you probably don't need to, but that we're asking you to do out of utter caution.
Okay, next question. I've read that excessive mortality is an indicator of deaths from COVID-19 that were not diagnosed as such. I understand that we haven't seen that in Mariposa County. Can you address that, please?
Sure. So excess mortality is a calculation of deaths that are above and beyond what you would expect based upon the time of year, the season. And yes, we have not seen that. I've been working with the deputy coroner on trying to identify any peaks or unexplainable deaths. I mean, the nice thing about working in a small county is you have that built relationship with other government agencies and looking for those unusual deaths. And we have not seen that in our jurisdiction, or for that matter, the counties that we work with in the area coordination team have not seen it either. And that's an important tool that allows us to give us kind of a heads up that other things are happening, whether it be COVID or some other disease process.
Okay. Are locals allowed to go for a drive into Yosemite Valley?
So going into the park, you'll still need, like everybody else, a day use pass, and that you get through the recreation.gov site, and there will be links there for Yosemite, or it'll be on our Facebook page and you can link from there. I will say one of the other questions that keeps coming up is the ability to cross Tioga Pass, and that's something that's going to be allowable this year, just like it has been for the last, I've been told, 20 years, where local residents within specific zip codes will be able to transit Tioga over to Lee Vining, etc. And more details will be announced about that by the park tomorrow. So look forward to their announcements on their Facebook and on their social media tomorrow. So more to come on Yosemite.
Okay. So why can protesters gather and stand elbow to elbow, but families are not allowed to attend graduation? No sense after all we've done these past 3 months to protect others, and now we allow others to enter our community. Time to take a chance.
So I'll take that. I think it is time to take a chance. We are opening up, but in terms of the school and the graduation, really that's something we've developed in cooperation with the school district, and they have their requirements to reduce risk as well, whereas protesters who are freely assembling are not under any guidance aside from that free assembly. And even there, if you look at the 300 people or so that were gathered in here in Mariposa last weekend, they were exceeding that 100 rule, and I get that. And we are concerned not so much about that group because, like I said, we don't have a lot of disease, if any, in Mariposa, and there weren't really a lot of number of people from outside of Mariposa in that. But where I do get concerned is the large gatherings that were in the large cities and allowed for commingling of bubbles. And I fear that we're going to see an increase of transmission just from those protests alone. And then getting back to graduations, the risks we wanted to mitigate were bringing people together from outside of your normal pattern. So not close family members, but people who come from out of town. And that's what we were working towards. And we've been planning for this for several months, and to change course at the last minute to allow for a larger graduation was just not feasible.
Yeah, I can say that when it hits close to home, I had a 5-year-old graduate to kindergarten. I had an 8th grader graduate this freshman year, and I had a high schooler that's getting ready to graduate this week as well to go to college. And as a family, it's a struggle. However, I go back to the message we gave earlier, which is as many activities as we can do as a community together to limit the ability for the risk to come into our community will make us safer. It is it's a loss, obviously, but our ability to keep us safe is what's important.
If we get a call from a contact tracer, how will they identify themselves, as in not a scammer?
Yeah, so they're not going to announce that they're scammers, obviously, but they will say that they're from Health and Human Services, from the Public Health Branch, and it actually is probably someone you know, because the folks who will be doing our contact tracing will either be one of our public health nurses, Margarita or Marty, or one of our sheriff's staff underneath Sergeant Bobman. So it's actually people you know. That said, if you get a call and you're suspicious, just call back to the health department, 966-3689, and have them connect you with the public health nurse and verify that we're actually making an attempt to contact you. Conversely, for larger counties, they are going to these virtual call centers. So something that you might experience if you're not in Mariposa, in another county, is that you may get a call from a virtual call center that are staffed by state employees. And so something to expect, again, not if you're in Mariposa, but a larger county like Fresno or Stanislaus, where they're doing active contact tracing.
Yeah, I think the risk might go up, well, not risk, but you may receive one of those calls of somebody that stays at one of your VRBOs or hotels, gets ill and goes back to their county, and they attempt to contact trace. From there, we may get some out-of-county calls. If if at any point you're concerned, notify our public health department, and we'll reach out to the county that's calling to make sure it's legit.
Okay. We have heard that there is an accuracy rate of approximately 58% for COVID positive testing for people. What is the accuracy rate for the wastewater testing?
So the accuracy rate that you're referring to is serology, and serology is based upon a prevalence of the disease in the community and the positive predictive value and the negative predictive value of the test. And what we know with serology is it's a real mixed bag right now in terms of sensitivity and specificity. So what that means is the more people you have that are positive in your community, the more likely your numbers are to be correct. So set that all aside because that's serology. The sewage testing is based upon nucleic acid amplification testing, which is similar to PCR. It's using molecular diagnostics. So it has the same sensitivity and specificity, or similar sensitivity and specificity, as does the PCR test that we use for diagnosis of clinical disease. So in the high 90s.
Okay. When will the pool open?
Pools are open.
Pools are open. So that's,
I would say prior to opening your pool, it would be best to go to covid19.ca.gov to sectors for swimming pools. Anytime we open something in a sector, it's important that you have a written plan, especially if you're a public pool or there's a pool in your hotel. A plan to make sure that you have the right cleaning. It has all of the guidance for how often and when. And if you have any questions, you can give us a call.
so I guess one of the questions is Parks and Rec is going to open their pool. Do you know when that's going to be?
I don't know the date over there.
Okay. I do know they're going to plan on being open by the 15th when day camp starts, but I don't know if it's going to be this weekend or not. But we can follow up on that. We'll put it on our Facebook.
All right. Next question. What percent, if any, has the COVID testing in Mariposa County shown asymptomatic positives What percent, if any, has the COVID-19 testing in Mariposa County shown asymptomatic positives? And are there any longitudinal studies about this currently being conducted in California?
So to the first question, the answer is there have not been any asymptomatic cases that have been reported in our testing at OptumServe or through our other clinics. And then are there any longitudinal studies looking at conversion from asymptomatic or pre-symptomatic patients or asymptomatic patients? The answer is yes. And of those, what I've seen so far is about a third of people will have a viral carriage that is high enough to be transmissible, but have no symptoms. But most of those end up developing symptoms within a day or two after that. So they're pre-symptomatic rather than asymptomatic. And the truly asymptomatic, those who never develop symptoms, I've seen anywhere from 1% to 10% of studies. So the majority of transmission you're going to get are from either symptomatic people or people who are pre-symptomatic.
At this stage, how many can gather in a group?
So we're currently still at the 10, except there are some exceptions for that's why I say we're in 2.98 or 3.14, because we're kind of, we're honestly confused as well as what our gatherings are. And at this point, the best we can tell you is the current baseline gatherings are 10 individuals. That's the lowest group gathering. But then you're allowed to have gatherings that are up to 100 or 25% of occupancy, whichever is lower for churches. And the same for assemblies for free speech, like the protests we saw in the Arts Park last Saturday. And then in between, there are some things that we're sorting out, like within the fitness guidance, you can have classes as long as you're maintaining appropriately socially distanced within that classroom or within that fitness space. But we know working with our gyms and with our fitness places that they're not going to exceed the 10 anyway. So we're not really that concerned about those folks. But again, as we sort through stuff, what we do know is that large gatherings are still not allowed. Things like music, things like theaters, right now still not happening. But we will let you know as those guidance change. And I anticipate that if things go well over the next 2 weeks to 28 days, so 1 to 2 incubation periods, we'll see those things change. If we see an increase in cases, we'll probably stay status quo.
I have gotten a lot out of a podcast called This Week in Virology. Do any of you listen to it?
Yes. I won't say in my copious free time because I don't have any, but I do find it valuable. There are other things that I look at too. Emerging infectious disease is worthwhile, and I'm trying to think about what else I refer to on a regular basis, but yes. Virology Down Under.
I was going to say, I would say yes, but it'd be a lie, but I will look into it. It sounds like a good idea. I have not yet.
All right, next question. When will Bryceburg camping open?
Well, camping as a sector opens today. As far as Bryceburg, we'd have to look in specifically to Bryceburg whether or not they'll be opening today, but camping as a sector is allowed.
Yeah, and what we got is feedback from, so Bryceburg, if I recall correctly, is a BLM, and so I don't know the specifics on that. Forest Service is already planning on opening up some of their campgrounds that are run by concessionaires this weekend. The Forest Service camps that are run by the Forest Service themselves, probably another week or two.
So just a point of clarification, when sectors open doesn't necessarily mean that's the date that we open. So I think restaurants were open a little bit before we opened restaurants in Mariposa. So part of the sector guidance to planning to opening is dependent on the owner or leader of that property or that event, making sure they feel like they're ready to go. So although the day is today, actually it's the 12th for the general guidelines from the state tomorrow, you're best served to call ahead to find out, because you may find varying dates of opening, like Eric just talked about, not just for the camping sector, but for day camps and places of worship and all the sectors or restaurants, any of those, call ahead. I think it could save you some time in the car.
Okay. Will the 24-hour wait for cleaning hotel rooms apply to Yosemite lodging?
As best we can tell, yes, but the park is exclusive jurisdiction, and they have been moving in cooperation with us in terms of all the counties that surround it. Mono, Mariposa, Madera, and Tuolumne all have similar health officer orders, or essentially the same health officer order for 24-hour vacancy. And when I was talking with the park yesterday, they were hoping to implement that as well, but that's something that they are getting approved by their higher headquarters in DC.
Okay. When do county offices open?
Some county offices will open on June 15th, which is Monday. Like Health and Human Services will open on June 15th. Some are still working through plans. So just like the sector guidelines, I gave you a phone call before you go to, I think building, planning, and environmental health have a process set up. If you call them, they can help you there. But call ahead before you go to any of the buildings. As a general rule, the county will be open on Monday.
So only 10 people are allowed at the pool that's open?
Well, I think an assembly of 10 and having socially distanced more than 10 people in a pool is two different things. I think you can have more people in a pool than 10 as long as they can maintain social distance. I think it's one of the distinctions between pools and hot tubs. Hot tubs tend to be much closer within 6 feet of each other. And so that sector for hot tubs still hasn't opened, but pools have. So it depends on the size of your pool. If your pool is large enough to have more than 10 that can socially distance, then you'll be okay.
Yeah, and again, gatherings, the concern with the gatherings is you're actually coming together, even if though you're trying your best to be socially distant. We know that's a challenge to maintain 6 feet distance. The other thing I'd point out with spas, hot tubs, things like that, is they tend to generate more aerosols than does a swimming pool. Swimming pool, like you're splashing stuff, those are droplets, larger particles. Spas, whirlpools tend to create smaller droplets that float and hang longer in the air and are more effective in transmitting disease. So I think that's the other concern with why spas are still, or whirlpools, et cetera, hot tubs are still in the not to be used category.
All right, next question. Can all houseboat owners access the lakes now?
Yes, and I think that was actually true as of last weekend, wherein we've had this idea that local travel was permitted and not extensive travel, but even with the modification that's coming up sort of this weekend is yes.
Okay. Can we have live music outdoors if we ensure there are social distancing and we can have more than 10 people?
At this point, no. Again, the concern with creating a venue is bringing people together, commingling, the mixing of disease. And again, at this point, I'm concerned that with opening our economy, with inviting people up here, that increases that risk. And so at this point, I think it's a prudent thing not to have larger gatherings.
Okay. Where can I get my hands on the Lysol disinfectant, aerosol spray, or something similar? I've got my PPE, disinfectant cleaning supplies, sanitizing wipes, and hand gel, but I'm unable to find the spray since COVID broke out.
And our public works department actually has ingredients for that. So I actually think we can send it out to you or post it. It's basically a make your own, and there's ingredients that are readily available. And then our Lysol brand, unfortunately, I think all of Lysol is sold out for quite some time, but we can put something out on if we're allowed, to give you, or you can generally look that up on the internet. There's quite a few recommended cleaning sprays. I don't know that we have one specifically, unless you have one, Doctor.
Nope.
Okay.
And actually what I will say is that in the guidance, there are hyperlinks to the EPA list of all the approved disinfectants. So if there's any question of what will work against COVID, pull up any of those documents and hit the hyperlink for EPA approved disinfectants, and you'll get a whole washing list of what works.
Yeah, you can go to the Mariposa County website. It should be on any of the sector guidance. Tends to have a link to that.
All right, and clarifying, the question about the 10 people at the pool was related directly to the county pool.
Yeah, so Mr. Brower or Mrs. Brower, I would call Mike Healy over at Public Works, but they'll have more than that for day camp in the pool. So I know that they have a plan already. We've worked with them, and he can give you the specifics on the quantity or capacity of the pool at this time.
Okay. Can Madera residents camp at MID, Lake McClure, and Lake McSwain campgrounds?
Yes.
All right. So are bars supposed to be planning bands from out of town, and how many people can attend?
No.
No, I can't. I can amplify on that, but at this point in time, I don't think it's bad for them to be thinking about planning, because eventually we will move from where we have small gatherings to where we allow music venues, but then they need to be prepared to cancel them, and however far in advance they need to cancel them to ensure they're in the contract. But at this point in time and for the foreseeable future, and I'm guessing 1 to 2 incubation periods, 14 to 28 days, we should not be planning any large scale gatherings more than 10.
Yeah.
All right, next question. What is the guidance on travel outside of the county?
So I will say our joint information team put together an awesome graphic, infographic that's on our webpage on our Facebook. It's the 6 things to kind of consider. Are you going from a place that has high transmission? Are you going to a place that has high transmission? Do you really need to go there? What are the mitigations that you can put in place? Are you sick? And then what are you going to do when you get back in terms of testing? And those are sort of the highlights. Look at that. That'll allow you to figure out whether it makes sense for you to travel or not. There's always the essential or urgent travel. So as an example, I've got some urgent business that I need to do. I'm leaving the county tomorrow. But I've thought really carefully about that decision process and how I can mitigate it. And then in terms of non-essential travel, how I think about it is what's the risks associated with that non-essential travel? Is it worth the non-essential travel? So going into the park, spending some time in there, being in a wilderness situation, not getting close to anybody, low risk and fairly close. But say going to the Bay Area, probably not as safe.
Okay. Has the non-essential travel ban been lifted for out-of-county travel? So anyone in California can travel to Mariposa?
So that is something that we've not really received clear guidance from the California Department of Public Health on right now. How they're kind of phrasing it is that you can travel for recreation, you can travel for leisure, but you should consider those things that we just talked about. And more importantly, they say limit your travel to as near as possible for that particular activity. So the way I suspect some people are looking at it the same way I am is that Yosemite is a World Heritage Site. There's very few places like it. So if you're coming from the Bay Area and you're coming to Yosemite, then that's probably within that interpretation of the modification of stay at home. And so that's why I think we're in a position to expect travelers from throughout California.
Now that bars are allowed to open, are we able to sit at the bar countertop? And do we still have to order a meal?
Yes, as well. Yes to the first part, as long as you can socially distance or there's appropriate barriers between seats, bars are open. And you do not have to order a meal. So I understand that appetizer sales will plummet in Mariposa now. However, that just changed for the county. So bars and wineries were all alerted on Tuesday of this week to that. So if you have any questions, I would continue to send you back to the state guidelines around bars and wineries that came out on June 5th, I believe. Yeah, June 5th.
And are just active today.
Yes.
So that's all of these things that we're talking about in terms of the guidance went into effect today. So there are still things that will be in progress of changing. And one of this is about the bars and being able to maintain social distancing. The other concern with bars is the ability to stay away from the person who's tending the bar and maintaining social distance from that person. So if you can't keep 6 feet between you and that person, the bar still may remain closed.
And as said with all of the other sectors, it's if you go into a bar and it's packed, understand it's really high risk. And it's not what's intended with the sector to open it. And secondarily, if you go in and somebody says you still have to order food, it's because the bar has not moved forward. They can be more restrictive than the county or the state guidance. They haven't moved forward with that rule, so you may encounter that rule. It doesn't mean they're doing anything wrong. It just means they're not prepared to move to the next sector for bars and wineries.
Our next question. So if I have a Mid-Pines address and I want to go visit family in Mammoth, I can do that. Is that what I understood?
That would be correct. And now granted, it would be a long drive right now. I would wait a few days. And then you can get your through pass from the park and have a shorter drive to Mammoth. But again, that will be in a few days, at least after the weekend. So I say check Yosemite's webpage, see when the opening is going to happen.
What monitoring will there be to ensure that all are following the guidelines?
So really what we're doing is looking at it as a community effort and a community basis, is that if we don't have people that are adhering to the guidance, we'll see an increase in community transmission. And then we'll be layering back on those measures that we're relaxing right now. So I would say the first thing that we'd be doing is doing an outbreak investigation and see where these cases are arising from. If they're arising from a particular sector, as an example, using Tuolumne, if it was in a skilled nursing facility, we would be looking at what infection control practices would be in place there. If we could not identify a specific sector or specific source, we'd be looking at those things that bring people together, that decrease our that make our bubbles bigger and make the idea that we're commingling greater. So we would do like Joe said, what happened in Lassen County, we'd be shutting down our sit-down restaurants, we'd be shutting down our bars, and decreasing those opportunities for mixing that allows for germs to be transmitted. That's in general how we would be monitoring for those. We'd be looking at cases and then implementing mitigations based upon those cases.
I think in some scenarios, were a case to be found in a business or property that was clearly not following the guidelines, then there could be, I mean, just like we might have to quarantine a property for 14 days after a case like that. So can't stress enough, we're doing this as a community, and there's always going to be someone that bends the rules, but we don't want them to, and we're not allowing them to. We really have to do this together. And I know that message is kind of, I think it's probably the fourth time I've said it during this call, but it's the truth. If we move forward, we will move forward as a community. We get to all the things that we want to have, like schools open and things of that nature. And if we don't, we'll go back and we have to close things down because we'll have community transmission. We'll have cases we don't know where they come from. We'll have death or loss in Mariposa, and that's all what we're trying to avoid.
Okay. Can a Mariposa employer put you on unpaid leave if you go out of town?
Unfortunately, I'll put my HR hat on. There's not enough information in that question to answer, but if you directly send me one at jlynch@mariposahsc.org, I will answer it for you with specifics.
Doesn't allowing people from all over California to come to Yosemite increase our risk here since they will be using our stores and restaurants?
Yes.
Yes.
Okay, that is the last question I am seeing. Going to make sure that nothing was missed.
And so while we're looking for more questions, the answer is yes. Anytime you have intermingling of different locations, different sets of people, you're going to increase your risk. And that's why we really want you to be brilliant on the basics, is the phrase I've been using. Those things that I started talking about 3 months ago that are important in disease transmission and cutting off buds of transmission. And you guys have been awesome at it. The hand washing, the staying home if you're sick, screening yourself for symptoms on a daily basis, not touching your eyes, your nose, your mouth. And now I'm going to encourage more because we are seeing more people, or will be seeing more people up here, is wearing facial covering. I've not been pushing that a lot because I know the prevalence of disease here is low. But I think, again, because we're increasing that risk, because we're taking that risk, because we want to balance what we're seeing with the disease with our requirements for the economy, that we can manage that risk, but we need to do more to mitigate it as well.
All right, and I have one final question here. Will tourist buses with foreigners be allowed?
So right now, most foreign travel is not permitted. So travel from Asia isn't happening. Travel from Europe isn't happening. I think both are restricted. I know Mexico travel is still limited. Canada travel. So most international travel at this point is fairly limited. So once that restriction's lifted, I suspect we'll see tourist buses back, but that will probably be a while given that the international travel's controlled at this point.
All right, we got a few more after that, so we're going to try and get through. People from out of our community are already coming in and using our stores, and we are already at greater risk, right?
Correct. And so that's, again, I think I'm happy to have this guidance out because it really does give us the directions that we want to put out to our businesses so that they can reduce their risks in the workplace. And again, layering on top of that, those individual actions that you want to do. And I can't say it often enough is we've got this testing ability that's free to you on Silva in the old middle school. please take advantage of that, because again, we do know there's people that are asymptomatic and pre-symptomatic out there, even though, again, we haven't detected it in our county yet.
I think the testing is every 2 weeks is your recommendation.
So my recommendation is, if you've got close contact with people who visit from outside the area, whether you're working in the hospitality industry, whether you're public safety, a first responder, firefighter, whether you just like, if you're out in town an awful lot, getting tested is a good thing to do.
All right. Can you reiterate that masks are still considered, but we should continue to use these masks to protect ourselves, please? I don't see as many masks.
So yes, more mask wear, but again, it's not about protecting yourself. The facial coverings are about decreasing transmission to other people. And so that's sort of, I'm protecting you and you're protecting me by wearing that mask. And it gets back to our community again. The reason I haven't been pushing for it hard is because the prevalence of disease here has been low. But now we are, now we're opening the doors, and we'll see more people in our community, and the chance of asymptomatic and pre-symptomatic transmission is increasing.
Okay. I have a short-term vacation rental and work with Airbnb and VRBO. We are not allowed to ask any details about guests, like their ages, where they are coming from, where they have been, etc. I am trying to ask the questions, but it's delicate. I have been inundated with bookings over the past 3 days. Some information I have gathered is that we certainly have guests coming from San Francisco and San Diego and Los Angeles, but we also have people coming from Wisconsin, London, England, and Salt Lake City, Utah, for example. Many of the guests are going to be joining friends and family from different locations. I don't get to learn this information until after they've booked. Frankly, I'm concerned.
So again, it gets back to our concerns as well, why we're asking all lodgings, whether they're Airbnb, regular hotels, VRBOs, to do that 24-hour settling period, because that reduces risks to either you as the person who's doing the housekeeping, or the people you're contracting out to do the housekeeping, and then limiting your contact with those guests while they're there. We talk about a close contact as being within 6 feet of a person for 10 minutes or longer. So having the ability to decrease the number of opportunities by decreasing your number of close contacts is critical. If they're moving kind of in their own bubble, they fly in a plane, they get here, they get in a car, they come to your Airbnb, they go into the park, they come back from the park. There's less risk than that, but then they'll go out to a restaurant, they'll go to a store. So it's, we know it's a risk, and what you can do, again, refer to the guidance, look at the ways of minimizing that risk.
Yeah, you think about that group. If they come together and they stay in your VRBO, and you do a proper job of cleaning the linens and the dishes and all the things that they come in contact with, and then when they go to town, they have barriers around them in their restaurant, and their servers wearing a mask, and they have single item units, and then they go to a retail store and they're making sure they don't have a fever, they're socially distanced. It's the safest that you can be with that scenario. Minus any one of those steps, and your risk increases greatly, although your risk is already there.
Right. If you have a permanent disabled placard, do you have to make reservations for going to Yosemite, and what is the fee for disabled?
I'm going to steer you towards the Park Service website. I know there's still a handling fee of $2 for using the reservation.gov site, but I don't know who that applies to. So I would steer you towards the reservation.gov site or the Yosemite National Park Facebook page.
If you are put on unpaid leave for 2 weeks, are benefits available?
It's very dependent on the scenario. If you are out because you have somebody that directly has COVID and you're in quarantine, you're eligible for full benefits. If you're out because you have an underlying health condition, childcare, or other issues that are COVID related, you would receive 2/3 pay. And that's not just 2 weeks, it's 12 weeks. But again, if you could send me an email specifically I can talk to whoever about their specific scenario. And if I don't know the answer, I'll have the HR department in Mariposa get an answer for you.
Okay. If I have to go to the Bay Area for appointments, example dental, do you recommend that I get tested when I get back to Mariposa?
Yes, but not immediately. So we know there's an incubation period, and so we say at least 2 days after your last exposure. 4 days is probably better. So say you went down to Santa Clara on Monday, getting tested on Friday would be your optimal time.
All right, and one last question here. Thank you for all of your information. Although it's not a priority, I'd like to know why live music is still being prohibited. If it's about singing, spreading droplets, could bands use a screen or plexiglass?
So it's not about the singing itself, though that's really interesting, as we do know from a couple of outbreaks associated with church choirs, is that singing at the right pitch really creates micronuclei, smaller bubbles that hang in the air longer. But no, it's really about bringing people together in groups that are large. So if you're singing by yourself or a couple people, it's okay. But what we get concerned about, whether it's music or other gatherings, it's the gathering. It's bringing together those people from different bubbles into one big bubble where you're mixing the germs inside that and allowing for transmission or potential transmission.
All right, thank you everyone for joining us tonight. This video will be available on Facebook as we finish up. You are also welcome to call the Mariposa County COVID Call Center with any additional questions. That phone number is 209-259-1332.
All right, thanks so much.